Welcome to Rewriting the Risk, Thriving After Breast Cancer. So first things first, this video is for educational purposes and presents a functional integrative approach that may help manage common side effects of, guess what, aromatase inhibitor therapy. It's not medical advice and does not replace guidance from your oncology team. Never stop or change a prescribed cancer medication without talking to your prescribing physician first. So let's get on with it. If you're on an aromatase inhibitor, and the common ones are anastrozole, letrozole, and your hands and knees or hips have started aching in ways you have never before seen or felt, you are not imagining it. You are not just getting older, and you're absolutely not alone. Today, I want to talk to you about aromatase inhibitors. I'm going to call them AI, joint and nerve pain, and why it happens, and what the research actually says helps. Here's what most survivors are never told before they start these medications. Joint pain associated with aromatase inhibitors, sometimes called AIMS, or aromatase inhibitor associated musculoskeletal syndrome, affects roughly half of women within the first year of treatment. And most say it's absolutely unbearable. This is the number one reason why women consider stopping their AI early. Not because the medication isn't working, but because the pain becomes so hard to live with. This is absolutely known by most, documented, a physiological response. It has a name, it has research behind it, and it has real strategies that can also help. You know, toughing it out for the next 5 to 10 years is not an option for anyone. Can you just imagine? And it gets worse as time goes on. So aromatase inhibitors work by blocking the enzyme that converts other hormones into estrogen, which is exactly what makes them effective against hormone receptor positive breast cancer. But estrogen also plays a supportive role in joint cartilage, connective tissue, and the sheath that protects your nerves. But when estrogen drops sharply, that support drops with it. And the result can be achiness in the hand, and this is nerve-related symptoms like tingling, numbness, or that, pins and needles sensation. Some research also points to increased inflammatory signaling and changes in how tendons and connective tissue around joints behave when estrogen is suppressed. So, folks, this isn't in your head. It's a hormonal and inflammatory shift with a real mechanism behind it. But the good news is that this one is one of the most researched survivorship symptoms out there, and a few strategies consistently rise to the top that may help. So let's see what those are. Number one, movement. Specifically, structured aerobic and resistance exercise has been shown in clinical trials to reduce AI-related joint pain. Not intense workouts, just consistent, moderate movement most days of the week. Number two, vitamin D is so important for many reasons. Low vitamin D is also associated with worse joint symptoms on AI therapy. And correcting a deficiency is one of the simplest levers available. Number three, omega-3 fatty acids alongside a broader anti-inflammatory eating pattern may also help. Number four, glucosamine and chondroitin have shown moderate improvement in musculoskeletal symptoms in clinical research, but you have to use them for a few months for results. This is worth a conversation with your provider if joint-specific pain is your main issue. Number five, acupuncture and auricular point acupressure have both been studied specifically for AI-related joint pain. with encouraging results for pain and stiffness. So if pain is affecting your quality of life or your ability to stay on therapy, that's a conversation you have to have with your oncologist, not a reason to stop on your own. Options like switching to a different aromatase inhibitor, a supervised treatment pause, or a structured pain management program exist specifically because this side effect is so common. Joint and nerve pain on aromatase inhibitors is real. And as mentioned, it is very common and it is manageable. You just need the right information and plan that fits your body. So remember, the bottom line decision is ultimately yours, whatever that may be. But don't forget to factor in your particular diagnosis and your risk of reoccurrence. So if this helped you understand aromatase inhibitors, there's a lot more to come on various topics. Hit the subscribe button to help my channel so I can help you rewrite the risk of reoccurrence. I'll see you in the next video. Stay strong, stay informed, and stay absolutely thriving.